life doesn't have to be this way. And he said it to me just that simply, just that articulately, and it was probably the single most powerful sentence spoken to me as a human being in my life.
Wow.
Your life doesn't have to be this way. And it was like a bolt of lightning. I mean,
Wow.
I could call it a burning bush experience. I don't know what really rings a bell with people, but for me, it hit me in that moment, in an orange jumpsuit, completely defeated, sleeping on the floor on a sandbag mattress in an overcrowded jail cell. My life does not have to be this way.
Addiction is not a surprise to God. We've got to stop acting like it.
This is Recovery in Christ, where we equip the church and bring hope to the hurting. We're back at Recovery in Christ. We're talking to Dr. Wind. He is the director of clinical strategy here, and he is just a wealth of knowledge. And we've been talking a little bit about helping versus enabling from a biblical perspective.
Yeah.
Welcome back.
Thank you. Glad to be here.
Yeah. So much fun. So let's talk shop a little bit. You and I have both, you've been in this space longer than I have. I've been coming up to 15 years. When we're talking about enabling, let's give a real-time example to people listening, because maybe not the worst case that you've ever seen, but I mean, I guess I'll give it there's time that we deal with parents, with moms, even with dads,
Sure.
and it's like there's just this mask over that it's everyone else's fault. This is why my son's doing this is why my son's doing that. And when you try to have them set a boundary, they know what's best for their son, so overbearing. And there's been certain cases for me that I've just been like, I've almost wanted to tell them, hey, you need to leave. Like, you're the reason, you're a big part of this reason. And so it's overbearing. So there's an overbearing enabling that's almost like I need to be the healer. That's their identity, the parent or the spouse, that as long as they're sick, then they're in this position. And that's not necessarily enabling, but I've seen like such drastic cases that is so harmful. Can you share any experience like that over the years?
Absolutely. Sure. I know we agreed to not necessarily delve too deep into the concept of codependency as part of our discussion here, because that's a separate topic in and of itself, et cetera. However, it is difficult to discuss any of this without having a backdrop of what codependency is. Now, codependent behavior can be very controlling, right?
Yeah.
There's something called the codependent need to control, right?
Yeah.
I need to put everything in place around me in my life. By the way, I need to make sure everything's in place for everyone else, not me, right?
Yeah.
Because that's too difficult, right?
Yeah.
I'd rather shine the spotlight on other people than have it shown on me, which feels like an interrogation for all of us to look deep into ourselves, right? So it's easier to look externally and put things in place the way I think they should be ordered in God's world, right?
Yeah.
Just listen to the insanity of that, right?
Yeah. Wow.
So there is such a thing as a codependent need to control. The healthy approach comes from the codependency literature, where we talk about healthy detachment. I'm going to let go of this situation because it is not serving you, nor is it serving me, nor is it serving anyone right now with circumstances in place the way that they are. I'll give you an example.
Yeah.
I don't mind sharing with folks that I'm in recovery myself. If I make it to March 7th of next year, I will celebrate 23 years in recovery from alcoholism. Alcohol was my thing. So
you stopped drinking, a year later you got licensed.
I actually got licensed very quickly after that, within a number of months, and was then kind of urged to start working in the field, which felt really uncomfortable for me. I was less than a year sober, and someone said, hey, how would you like to do psychological testing on these professional folks that are in treatment? And I'm like, are you talking to me? Because I'm not quite a year sober yet. But nonetheless, with some encouragement, some oversight, sponsorship, mentorship, that happened.
Cool.
Nonetheless, being in recovery myself, as we talk about this, scenes kind of flash through my mind. With alcohol being the issue for me, one of my consequences was in the Department of Legal. I was arrested for driving under the influence. I got public intoxication tickets, all kinds of untoward type behavior, right? One such episode happened, and my father, who was a recovering pastor with many years in recovery at the time when I was struggling already, he modeled things for me that I don't think any other human being could. I think I'm here today because of him, honestly. And he enabled me at times. He bailed me out of jail. I remember, however, one time I was on the Outer Banks of North Carolina. Sorry, Outer Banks. Sorry, Dare County Detention Center. But nonetheless, I was arrested for DUI yet again. Some kind of harebrained scheme of leaving at a late hour to drive down to meet my family on vacation, and all but ruined the family vacation by getting arrested for DUI.
Yeah, I'm sure that was the call they wanted to hear. Yeah.
That was a tough call to make. Think about it. Back in the early 1990s, cell phones weren't really a thing then, right? How do you get in touch with your family who is at a rental vacation home on the Outer Banks of North Carolina from a detention center on that same island? I eventually made it happen, and my dad left me there for a little while. He detached in a healthy way. No, we're on vacation. I have priorities. I have all these other family members that are here. We're enjoying time and fellowship together. Your intrusion, which is exactly what it was, of a collect phone call from a detention center yet again while we're on family vacation, is not welcome. Not because I don't love you, but because I do. So I'm going to set a boundary here. I'm going to set a limit, and you're going to spend some time in there sobering up, thinking about this, and maybe exploring how you might get spiritually connected again and start to move in the right direction away from this disease instead of rushing toward it every chance you get.
Yeah. Yeah, that's a prime example about how
really good.
you are helping. He helped, and he didn't enable. Because if he would have gone, got the call, went and bailed you out, who knows what your life would have turned out, but definitely who knows how that vacation would have turned out.
It was a pivotal point for me.
Yeah.
And truth be told, I did not get sober the next day, right? That's not my recovery date in the early 90s.
Right.
As I mentioned, my sobriety date is March 7th, 2003. I had another decade of dysfunctional behavior in active addiction. However, it planted such a valuable seed that later on sprout, and I felt this at the time, something that was different, right? And it did actually push me in the right direction for the moment. Unfortunately, I kind of regressed back. This is kind of a relapsing condition that we struggle with, right? And I spent nearly another decade engaging in that type of behavior.
Yeah. But it was a rung in the ladder that I believe, and I think you do as well, that guided you to a place that you are walking in freedom and have for 23 years almost.
Absolutely. That's right. I remember another point at which my father did engage in helping type behavior. I was wearing an orange jumpsuit, if that makes sense to you. Yet again, a legal consequence, right? Predictive in the early 90s of what was in my future if I continued on that pathway, right?
Yeah.
So there I was incarcerated again, this time for 45 days in a county in the state of Tennessee. And my father sent a local pastor to visit with me.
Interesting.
I didn't know this man. I just was very happy to get out of the cell block for a few minutes. You have a visitor, and that was intriguing. I thought, gosh, who could be visiting me? And lo and behold, this man wearing a white clerical collar introduces himself, and I thought, oh boy, this will be interesting. Where did he come from? He said, your dad sent me. And immediately, it had this big emotional impact on me. And he said some powerful words to me that were transformative, which were, your life doesn't have to be this way. And he said it to me just that simply, just that articulately, and it was probably the single most powerful sentence spoken to me as a human being in my life.
Wow.
Your life doesn't have to be this way. And it was like a bolt of lightning. I mean, wow. I could call it a burning bush experience. I don't know what really rings a bell with people, but for me, it hit me in that moment, in an orange jumpsuit, completely defeated, sleeping on the floor on a sandbag mattress in an overcrowded jail cell. My life does not have to be this way. And what a powerful statement. That man sent by my dad as part of helping behavior, right? He had engaged in healthy detachment up to that point by now by stepping back and saying, I'm not going to continue to help you destroy yourself. I'm going to step back because I don't want to be a part of that, because I love you, not because I don't, right? And he did send someone in to speak to me, and boy, what a powerful statement that was. It changed my life.
Yeah, and so here, the point that I'm hearing, and I think that you should take home, it's not like you don't have to live this way was words that Dr. Wind had never heard. It's not like he didn't know that that was a common sentence by someone that he had never met, but the power of it was he wasn't bailed out of that county jail in Tennessee when he heard those words. He didn't hear those words sitting at the bar drinking. He heard those words locked up because he was in a situation that they didn't remove the consequences. And when you heard those words, God meant for you to hear those words in that moment, words that you've heard, words that you knew were possible. But when you heard that in that situation, in that season, in that hardship, it radically it changed you, you said. I remember an example that with my parents, and they were helping and not enabling. I'm sure they did enough enabling throughout the years, but I was separated from my wife. I had no place to stay. I had lost everything. They would allow me to stay at their home. They were both educators, teachers, both retired now. But in the morning when they would go to school, they would knock on the door and say, "Hey, you got to get out. You got to get out." And man, that made me so mad. I probably said the worst things. It's raining. It's cold. What am I going to do? Da, da, da. But the reality was that if they didn't do that, I was going to steal something from them and go and pawn it for drugs, for dope. And so I remember looking back now thinking, I was sleeping on a porch or something like that. Man, that had an impact on my life. Like in the moment I was angry and it was there and there's, but it's like looking back, I remember if they wouldn't have done that, if they would have caved to my words, my manipulation about how evil they were for making their son sleep outside, if they would have caved, man, I would have continued and continued and continued as to them not enabling me. I felt like that was a good moment. Let me ask you this. What kinds of support actually promote healing and change in someone struggling versus the kind of thing that keeps them stuck? Like we gave some examples about leaving them in jail, right? Not bailing them out for a few days, not allowing them to have comfort of sleeping in a home and parents aren't there. What are some of the kind of things that you think actually promote healing as opposed to, man, you're going to stay in this life of addiction?
That's a great question. I think really what we're talking about here at its essence is do's and don'ts, right?
Yeah.
Don't enable by continuing to open your checkbook or open the doors to your home, right? Don't enable by continuing to bail people out, literally and figuratively, right?
Yeah.
The do's is a really great question too. Do offer support. Do offer resources. I've told people before, I will help you help yourself, but I will absolutely avoid at all costs helping you destroy yourself.
Yeah.
And that's what enabling behavior is. So on the flip side, the positive side, if there are things we can do, it would be opening the door to resources, clearing a pathway toward healthy living, right? Clearing a pathway toward healing the spiritual malady, clearing a pathway toward getting the help that they need.
Yeah.
So if it involves payment to a treatment center of a small amount, a reasonable amount that is palatable to help get someone treatment, great. Payment to them as cash with the promise that it's going to be money that I use to go get help somewhere, that's obviously a don't.
Right.
The do is the former, right? Help them open the doors that will get them on a pathway of healing and spiritual freedom and a life worth living.
Yeah, that's a great, I think so many things we can go inside of that, but I do want to hit you with the last question. I've seen some people when it comes to enabling, and I don't want to go back to codependency and all that, but I think it's something that they are sick. The enabler has an issue as well, and or thriving from the person being sick, person being damaged. But on the contrary, I've definitely seen good-hearted people that genuinely just want to help, but they end up enabling. What would you say to someone who's afraid that setting boundaries means I'm giving up on this person that I love, or they've bought into maybe manipulation saying that this boundary is actually harmful? What would you say to them that they're scared to do that? They're scared to push back and set firm boundaries because they think it's going to hurt someone that they love?
It's very hard. And Adam, I think the first thing I would tell them is please seek your own help. Because we're talking about codependency, which is not an official diagnosis for various reasons I won't go into. But codependency is a very real thing. And when someone is truly codependent on someone who is dependent on a mood-altering substance, it can be an awful situation. They need their own help and support. Hopefully, as part of that help and support, what they will hear is positive reinforcement that healthy detachment, that setting limits, that setting boundaries is the loving thing to do. Getting that reinforced by someone who's in a helping, supportive position and a professional position, I think is invaluable. And there's also a question about motives in acting. This is really part of the codependency discussion. Why am I doing what I'm doing? Am I doing what I'm doing to create a facade, to create kind of an optical illusion that everything is okay in our family, to make sure that the other folks in the church setting view us as having our act together and everything being highly functional and we're just a happy family who's enjoying life, etc.
The mask.
Right. Or am I doing it truly as part of the human condition that involves being of service to other people, right? Sometimes being of service to other people involves making really tough decisions, and I wouldn't be cliche-ish enough to throw out the term tough love, but I will anyway. There's really a lot of value in that, right?
I agree.
And it is tough to make decisions sometimes that are made with a motive of love, right? That's really what it's all about.
And I mean, I think even if you're watching this and maybe you're the parent or spouse or child of someone and you were caught with the title maybe on YouTube that said hope or helping versus enabling, you're watching this, absolutely get the help like you said, but also hear what we're saying. Close to 23 years of experience, close to 15 years of experience, full time in this space. Hear what we're saying and allow yourself to, what you're doing when you have a safe and healthy boundary, it is actually, as he said, that is actually loving them well and helping them no matter what's told. I hope that you're hearing that. That's not just, you don't have to go far. I mean, there's close to 40 years of experience right here telling you that you are doing the right thing by setting a strong and healthy boundary no matter what's being told to you. It's the right thing. It's the loving thing.
Yeah, and this is so valuable for families. But I'm just sitting here thinking pastorally. Boy, it is a struggle for pastors because when you put those healthy boundaries in place, it's oftentimes that you don't get a positive response back. You're considered unloving, uncompassionate, etc. And I think it's important for pastors, recovery workers, anyone on church staff to understand that God has put you in that place as a shepherd, and shepherd's a rough job. Shepherd's a rough job. You're protecting from the wolves. You're trying to keep the sheep together. So I would just say this because I'm listening to you guys. I'm saying, man, there's a lot in this. There's wisdom, there's love, and there's vision too, right? So a lot of things coexist here. You're holding them accountable. You're letting them experience the natural consequences of their behavior, but you're doing it in love, and you're also giving a vision for what it could be. When you mentioned that guy gave you the most powerful words, life doesn't have to be this way. It's important for us to recognize that while we are allowing the natural consequences of our decisions, that we have to cast vision, and that's the hope of the gospel, and that we are not who we were, and that in Christ we can be so much more than what we're currently living. So we have to have that vision. So I would just encourage, anybody who's working in pastorally or in a church staff or even as parents, know your identity, know the role that God has put you in at that moment. People around you that are struggling in recovery need you to act in wisdom. They need you to act in love. They need you to put the strong hand of direction and vision.
Yeah. And as we close out here, do you have any final thoughts or anything that you want to say?
Carl just absolutely hit the nail on the head for me, and I want to highlight, and this is not disparaging in any way whatsoever, pastoral work is codependent type work, right? There are professions, and in my ministerial assessment specialist work that I do with a certain denomination, codependency is rampant, right? Any profession in which we're charged with the care of others involves codependency. In fact, it's probably why we were drawn toward that profession, right? Our families of origin create and set the table for codependent type traits, and as we evolve into human beings, it impacts a lot of things, but most importantly, the work that we choose and the mate that we choose, right? So codependency really informs and guides our choices a lot of times. So pastoral work involves shepherding a flock, right? That is a codependent type professional role. So is law enforcement, so is psychology, so are physicians, nurses, social workers, therapists, et cetera. The list goes on and on. By the time a pastor has kind of traveled down the pathway of professional identity development into ministerial work, I think a lot of them have it just kind of hit them, that codependency factor impacts them in so many different ways. Maybe they can't put their finger on it or identify it, but I would echo the same statement that I made just a moment ago about getting your own support and getting your own help. Pastoral support is absolutely critical in order to most effectively shepherd a flock because of those codependency
And not to do it in
factors.
isolation. Right?
Absolutely.
Because pastors, I could tell you firsthand, you tend to withdraw and let me handle this myself.
It's a Lone Ranger type phenomenon, right? Same thing with psychologists. You can be surrounded by people all day, but feel like the loneliest person in the world. And to me, that is kind of the definition of hell, complete and utter separation from God and feeling isolated alone in the world, right? Sadly, I'm familiar with that feeling, but I'm glad I felt it because it feels good to be on the other side and feel connected interpersonally and spiritually today.
How many on your incarceration tour? How many states did you get to hit up? I heard what I hear: North Carolina, Tennessee. Where we go?
You're going to have to give me a minute to add them all up. No, 1, 2, 3, 4.
Man, and to see
an interstate menace to society is really what I evolved into, man. It's a sickness. I don't know any other way to say it. And when I say spiritual malady, synonymous with sickness, right? Again, with pastoral work too, caring for folks, viewing them as struggling with an illness, having a spiritual malady, I think is a great lens through which to view those folks. It helps us to be more patient, understanding, loving, and to show them God's love in terms of how we care for them.
Speaking of that, if you or someone you know is struggling with addiction, we'd love to help. We at S2L Recovery, we are truly Christ-centered. We're state licensed and have a Joint Commission accreditation. And currently we're serving men. Hopefully in the first quarter or so of next year, we will open our first female facility. But if you need help, s2lrecovery.org, and the phone number is
888-380-2865.
You're going to need to check that. There's no way he remembers that every single time.
It's the one thing I remember.
Awesome. Thank you so much for your time.
Thank you for having me.
Appreciate you being here. This is awesome. All right. We'll see you next time.
Ciao.
Ciao.